Hey everybody, it's Dr. Daniel from the Neuropathy Clinic here at Fix Me, and today I'm going to talk about use it or lose it. And what I mean by that is there are two things that we don't use once we start getting the symptoms of neuropathy, and it's not something that we actively consciously think about, but we no longer using two parts of our body or using them effectively or normally, and then we start to lose function. And the first thing that I'm going to talk about is nerves, and of course, because that's the thing we notice. And so what happens is we start getting maybe numbness or tingling, and then it'll become burning, and it become pain, and all that is the nerve is not firing normally because we're not getting enough circulation. The issue with losing normal nerve firing is that as that becomes more and more frequent, it's a negative feedback loop, meaning the nerve has a harder and harder time finding the ability or finding a way to fire off normally, and so the symptoms become worse and worse and worse. And sometimes that takes a long time, sometimes that happens very rapidly. So one of the things that we use at the office is the Rebuilder, built by Rebuilder Medical, invented by Dr. Phillips, who I had the pleasure of doing a 30 to 45 minute interview with, and learned all about that machine and how it works, why it works, the importance of it. And the Rebuilder accomplishes two main things. Number one, it helps get relief, but number two, it conditions the nerve. And what I mean by that is really trains the nerve or allows the nerve to continue firing normally, even though all the things that are around it would lead it to not fire normally. And the reason why that's important is that will sometimes delay, if not prevent, further degeneration while we work on getting the rest of the body healed. And that's incredibly important because, as you know, nerves are the slowest healing tissue in the body. And so even when everything's going correctly, they're only healing at about 1 millimeter a month. That's best case. Now, we can get symptomatic relief much more quickly than when we restore everything, meaning get ourselves all the way back to normal, but it takes time and it takes repetition. And especially in cases where people are past stage 1 into stage 2, 3, and unfortunately sometimes 4, we're looking at months to years before the body has gotten to the point where it's recovered as much as it's going to recover. And the Rebuilder plays an important part because you're using it. And I should have said not use it or lose it. I said use it correctly or lose it, because the body's not using or not able to fire the nerves correctly. And so the Rebuilder, when we talk about how it works, I know there's some like NuriMed or there's some pads out there. Those operate on the EMS principle, and what that means is the signal comes on, stays at a certain level, and then turns off. So it's what I call a square wave. Your body doesn't fire square waves. Your body fires like that. Basically, it builds up charge and then discharges the electricity, and that's what creates the signal. And when you're using EMS, like the NuriPad, I think it's NuriPad or NeuroPad, it's just slamming current into the body. And that may fatigue the nerves so that you can't feel anything anymore, but it's not doing anything to maintain normal firing, because the axon of the nerve builds up charge and then it discharges. And again, it doesn't happen all at once. Nothing in the body happens all at once. There are no straight lines in normal body function. There's a flat line, but that's when we die, so we're gonna stay away from that one, right? And so the Rebuilder works kind of like a dimmer switch. It turns up power, and then it releases and turns it down. And it runs what I would like to call a smoothing function. So normally a nerve, when it's damaged or injured, is all jagged. And so the Rebuilder forces it to smooth out by adding or subtracting electricity. And that's extremely important, number one, to get you relief, but number two, to protect your nerve as much as possible while we're working all the things that were driving the neuropathy or caused the neuropathy in the beginning. And of course, if you've watched any of my other videos, you know that number one is metabolic inflammation. Of course, the most common cause would be type 2 diabetes, but we have autoimmune disorders, ulcerative colitis, fibromyalgia, Crohn's, rheumatoid arthritis, environmental exposures like Agent Orange, jet fuel was a recent one we heard that caused extremely early onset neuropathy in somebody who's just turned 40. All kinds of, that's metabolic inflammation. All kinds of things can cause metabolic inflammation. You need to tamp that down and then increase the circulation, and then the nerves will heal. And it's extremely important to protect those nerves, and that's where the Rebuilder comes in, and we use it properly so that we don't lose it. And that's just one component of our care, but one component that's extremely important. Sometimes when people aren't ready to start the whole thing, they do the Rebuilder, and that helps them control pain, at least in the short term. Again, not the long-term solution, because we have to deal with that metabolic inflammation, but everything works together. And of course, one of the very important components is the Rebuilder 300 device that we use for our patients. And I will actually include a link below to their website. It does require a prescription, so you can ask your doctor to write a prescription for you, and then you can order it directly, or I'm happy to help you there. Our contact information as well. Thank you, and have a great day.